professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this lecture, I'm going to be going over some of the competencies that are associated with applied epidemiology. The 8 skill domains which provide the framework for the applied epidemiology competencies are actually listed all here for you. Some of the tier 2 mid-level epidemiologist competencies are defined for each skill domain on some of the subsequent slides. But here, knowing some of these, the 8 of these, I think are important. These were established a couple decades ago, but they still are pretty relevant and pertinent. Assessment and analysis is a major portion of epidemiology, but then basic public health sciences, communication, community dimensions of practice, cultural competency, financial and operational planning and management, leadership and systems thinking, and then policy development. So the assessment and analysis, there's actually 9 competencies in this skill domain. So each competency is further defined by sub-competencies and sub-competencies that can actually be viewed in the full document, but for the sake of brevity, only the 9 major competencies have been included here. And so, of course, identifying public health problems, that is of utmost importance. But conducting the surveillance, so once you have identified the problem, for instance, if you're trying to monitor the prevalence of glioblastoma multiforme, a specific type of brain cancer, actually one of the deadliest types. Unfortunately, one of our Congress people had it. But if you're trying to monitor this, you need to conduct surveillance. You need sufficient registries and potential types of systems. So then investigating acute and chronic conditions. Sometimes there's connections between acute and chronic conditions. So really understanding this is important. Applying good ethical, legal principles to study design and data collection, dissemination, and use. Manage data, analyze data, summarize results, and draw conclusions. Recommend evidence-based interventions and control measures, and then evaluate programs. So these are all of the 9 major competencies that are associated with the assessment and analysis portion of this. The basic public health sciences, of course, this is self-explanatory. The knowledge of the causes of the disease, any laboratory resources that are used to support the epidemiologic activities. Very important to understand, of course. Then the final portion of that is the informatics and the data collection process, again, the analysis and an epidemiological investigation. And then, of course, you have communication, which is an important, not only written, but oral communication. And additionally, risk communication is an important basic principle that should be a skill that all public health or epidemiologists should have. And then also incorporating interpersonal skills and communication with agency, personnel, colleagues, and the public. And communication is actually an area that I personally specialize in, and it's not always straightforward because oftentimes And when you have experts, there may be varied opinions, and so sometimes understanding all of those is something that requires special skill and special knowledge set. So using this effectively is especially important. And then the skill domain for community dimensions of practice. Um, this fosters engagement with the community in epidemiologic practice. And that is really important because it has to go back to the community, whether it's at the state, local, tribal level. So the cultural competency piece, of course, it is crucial, describing the population by various parameters. And this has been updated more recently, so I'll be going over some of that as well. But I encourage you to go through the 7 of these. It's worth mentioning, actually, the establishing relationships with groups of special concern. So community advocates are actually representatives, are actually powerful individuals to be going to and trying to foster relationships so that you can conduct research and also enact change. Designing surveillance systems to include underrepresented groups as well. So there's vast amounts of data and information in the context of the majority, but the minority groups are not represented. Conducting investigations using languages and approaches tailored to population. So, for instance, when I had to understand the diabetes knowledge level of a specific population within my community, I wanted to make sure that I was inclusive in the process of how this was being done. And so in doing so, I realized actually through a pilot study that some of the individuals did not have any knowledge or very little knowledge of the English language. And so instead of making the choice of excluding this subpopulation and skewing the results of my data, I decided to take the extra step of translating the questionnaire and making sure that each of the questions, there are 20-something questions within the diabetes knowledge test, and had them translated in Spanish so that also the Puerto Rican community could be taking part of this all-inclusive study. So this is an example of cultural competency being practiced within the field of epidemiology. Incorporating social determinants of health or incorporating social considerations oftentimes do not take additional large amounts of funding. It's small tweaks that can really provide us with the ability to incorporate cultural competency. Using knowledge of specific sociocultural factors in the population to interpret the findings. We talked about language. We talked about standard population categories, subcategories. Now understanding the context of knowledge. So in this example that I was using, I'm understanding that culturally certain foods are preferred more so than others, so much so that the consumption of certain foods are attributed with even good health and a tradition that should be that should be promoted and continued from generation to generation. So some of the staple foods are considered part of the culture. So this understanding allows for any sort of changes to be made pertaining to health, if it's understood that the food is closely connected to the cultural context. So then the final portion of this, of course, is recommending public health actions that would be relevant to the affected community. And so then using all of this knowledge, we go back to the health advocates, the representatives, and provide the findings and provide suggestions for improvement. In my case, actually, what that meant was using the findings about the diabetes knowledge test. And I found that individuals who were actually Spanish speakers actually had scored lower on the diabetes knowledge test than those who were English speakers. And so this may mean that the patient-physician communication as it pertains to bilingual populations or populations who are Spanish speakers may not be as effective as a patient-physician communication between individuals who speak English. So every finding has implications, and recognizing these implications and tying it back to social change, tying it back to the social determinants of health allows you to empower the community that you're serving. So now transitioning to a paper that actually looks at more of a modern update of some of the CDC competencies that I reported to you about in the previous section. This is charting a future for epidemiologic training, and this was written in conglomeration of quite a few authors from multiple universities across the country. So this is kind of an interesting sort of insight on some of the issues that we have been discussing about. And so taking a look at this, so I will present to you 12 macro trends in epidemiology in the last 5 years, and also end with a call of action that has been provided within this paper. Again, this is a bit dated, but still relevant today. So taking a look at macro trend number 1, the growing ability of big data and informatics is, of course, now even more true a possibility than ever before. So there's no question electronic health records have just blown the door open, wide open, in terms of the possibilities that we have at our fingertips as to looking at traditional health topics, public health topics, and even conducting clinical trials. So at the time, the U.S. government had invested $200 million, but actually that some of that amount has actually increased. Macro trend number 2, the changing health communication environment. Of course, there's direct implications for the health of the population, how surveillance is being conducted. But the large number of studies being published, they get conflicting findings. So a lot of times social media is confused. And so increase in communication and social media by experts in the field is especially important. You'll find a lot of posts, a lot of people that provide their expertise, but sometimes that is not completely always evaluating all different types of realities. So that's good to look after. The Affordable Care Act, system reform, of course, that's one. The third macro trend in epidemiology, and of course, any alterations in that also. The number of uninsured, and I've actually talked about that because even with the Affordable Care Act, you had the Medicaid expansion, and so Medicaid expansion was left to state rights. And if a state governor didn't feel like cooperating with Medicaid expansion, then it didn't take place. And if it didn't take place, then that meant the most vulnerable populations of that state did not get the coverage that they needed, and that means that they suffered. And there are at least 12 states that refuse to take part in Medicaid expansion, and that's a travesty. So macro trend number 4 is shifting demographics. And in epidemiology, we're always thinking about shifting demographics, the aging population, increased racial ethnic diversity. Part of these changing demographics is understanding the ramifications of what that means. Sexual orientation, and there's a lot of different new challenges for epidemiology. It's a rapidly expanding field, and this paper was actually written before the pandemic. I especially selected a paper that was written before it because of the fact that I can reflect after the pandemic how some of these things has evolved even more from my expertise. And so the things that were of priority before still remain a priority. You still are spending time with neuroscience, chronic disease prevention, health maintenance, the impact of comorbid conditions. But in addition, we're having to grapple with some of the social issues that are critical to our nation, such as ethnic, racial, sexual orientation, cultural composition of the U.S. population. And that will require epidemiologists to provide greater emphasis in population health, identifying, measuring, proposing effective approaches to narrow down these health inequities. This is what we need. So macro trend number 5 is globalization. And I've lectured a lot about sustainability and understanding how to help maintain the Sustainable Development Goals. It's a process. Globalization is a process that leads to increased cross-country interactions and integration of markets and systems. So globalization has already increased the risk of global spread of communicable diseases, and so we saw that with Ebola and SARS. But when COVID-19 hit, of course, this was definitely a reality. This next one, macro trend number 6, I've actually been to a conference by the name of OMICS, Emerging High Throughput Technologies. And this is talking more about systems, whole systems. It's OMICS. Epidemiologic research now has the potential to use the combination of biomarkers and genetic sequencing to track clinical course of disease. So when non-clinicians and non-medical professionals are oftentimes trying to understand disease, it's often difficult to understand that there's a complex interaction of multiple types of components working together. Omics is one of those areas where multiple components work together. Genetic sequencing exists, but then there's biomarkers which activate or deactivate certain genetic sequences based on the interaction with the environment. And so this can sometimes, of course, most of the times, this is only limited to the person that is being exposed to the environmental impact, the environmental toxicant. But sometimes what happens is some of these expressions are actually not the genes aren't necessarily changing, but the expression of these genes change. And when the epigenetics, when the epigenetic expression of it changes, then eventually the epigenetic expression may have an effect on the genetic portion of the person that is then passed down to the next generation. So this is a complex sort of concept to be explaining, but the idea is that omics, the complex interaction of certain metabolomics, microbiomics, exposomics, these are all need to be explored more strongly, and this is why this is macro trend number 6. A greater focus on accountability, sharing of data, facing of the large expenditures of public funds on epidemiologic and biomedical research. This is truly important. And so stewardship of funds and epidemiologic findings back to stakeholders, very important. Privacy changes, HIPAA, can't emphasize this more. It's really important to be understanding the limits on the use of certain data and asking permission before participation in studies. Macro trend number 9, looking at upstream factors. Mental illness, obesity, violence, all of these have upstream causes. Many times they're interrelated. Social determinants of health, maybe it's poverty, maybe it's education, maybe it's both. Fuse intersectionality, housing, employment, missing basic needs. So there's concerns that epidemiologists have not adequately really focused on a lot of these things. So getting to the cause of causes, shifting social norms, understanding all of these is very important. The emergence of translational sciences. So the NIH foundations, authoritative bodies, placing greater emphasis on translational science. So implementation of research. So I'm going to just end with just the two last ones. The growing centrality of team and transdisciplinary science are very important, and the funding portion. Those are two things that are really important to understand the modern kind of version of epidemiology and the directions that we need to be heading in. Based on the familiarity of the curricula that we have in epidemiology, there seems to be some inadequate match between whatever the existing curricula is and some of the training activities in epidemiology and the future skill sets needed for epidemiology to remain effective and credible as a discipline. There's data scientists and biostatisticians. There's pathobiology, health communication, sociology. And so epidemiologic training needs to be supplemented by knowledge from all of these disciplines. So epidemiologic training alone is not necessarily sufficient. It's one that is needing other types of multidisciplinary knowledge as well. So there's some recommendations, in the next stage. Of course, there's 12 trends to broaden the competencies, but in the next stage for this, for, of course, dissemination, but the American College of Epidemiology does a lot of work with this, so it's important to seek innovative and creative ways of delivering training to keep pace with some of the newer trends, and hopefully this will stimulate more engagement and discussion as to how we can provide more technological sort of enhancements in order to revolutionize the teaching of epidemiology. Thank you for listening.